So these are our communities.
Their best pitch on display, hoping to draw big city doctors to a rural town. But the reality of healthcare in Northern Ontario isn't sugarcoated.
You might not survive that heart attack just because of distance, equipment, and personnel are not there.
Sioux Lookout, a remote town in between Winnipeg and Thunder Bay, has spaces for 52 doctors. Right now, it's got just 22. Known as the hub of the North, Sioux Lookout's doctors have to serve 33 remote communities, places that can only be reached by plane across a geographic area equal to the size of France. The money to build up the system is in place, with millions of dollars from the Ontario government to improve public health in the region. Now it's a matter of getting doctors to the north.
It's challenging to get someone who's used to living in an urban environment or they have family obligations locally to just pick up and move to a smaller town.
The doctors here, should they choose to move, will see a very different healthcare reality than what big cities face. High rates of diabetes, Hep C, suicide, and even rare medical cases like rheumatic fever have cost many lives in the region. Last year, First Nations leaders in the area declared a health emergency, prompting a response from the federal government.
Well, in the matter of Sioux Lookout, I think the first thing that it's important to say is that I certainly acknowledge, and our government acknowledges, that there are tremendous and unfortunate gaps in health outcomes.
Just because they're up in a remote area in Northern Ontario, it doesn't mean that they should not get that service.
Healthcare officials there are offering higher pay and relocation costs to bring doctors in. But for some, the desire to help is the draw.
You can go and serve humanity, and also you can enjoy the life there. Sounds fun.
Even if you're not sure if you want to full on move out to a northern community, at least there's that opportunity to try it out.
It's also the idea that within your work you're also addressing equity issues and issues with access to care.
The region's best chance are those young doctors, willing to take a chance, hoping to make a difference. Adrian Chung, CBC News, Toronto.